Hari Om Dhanvantari. Namami Dhanvantarim Adidevam Surahasrai Vandita Padapatmam Loke Jarar Vayamuttanasham Dhataramisham Yudoshadinam. So just we finished with Shodhana Chikitsa's Panchakarma. Prana Karma also we covered mainly Umana, Virechana, Basti, Nasya and Rakta Mokshana. Shamana Chikitsa. What are the Shamana Chikitsas? If the doshas are not deep-seated, we can use this Shamana Chikitsa. We have told about it already. Deepana, enhancement of digestive fire. Means whatever I have, the food I have taken inside, my digestive fire, my Agni is not Sama. Manda Agni it is. Even the water to digest also we require fire. Here that is not happen means it definitely causes us a problem, diseases. So Deepana, the digestive fire of mine has to be increased. You want to digest water or a milk, whatever we eat into. So basically this is very, very prime part what we do in any case. Deepana. Pachana, assisting the process of digestion. Already I had a food. I know it is not digested. It's retained, causing diseases because of ama. That should be digested. Pachana, jeernisuvudu. For the undigested food gets digested and expels out. Shuddha, improving the appetite. So with Deepana, with digestive fire increasing also, my Shuddha improves, my appetite can happen. My intake of Shuddha can be enhanced because of the Pachana also. So they work one into a hand. So Deepana also increases Shuddha, Pachana also helps in the Shuddha. So totally our basic line of treatment in Shamana has to be to improve the appetite. Trishna, improving the thirst. Some people say, I don't feel thirsty at all. Udakavaha Shrotas has been affected. Even Mutravaha Shrotas also can be affected, which are mainly deals with the Mahabhuta. So improving the thirst also should be taken care. Vyayama, physical exercises, is very important. If I am lazy, if I just sit in a corner not doing any movement, the Agni cannot be increased. If the Agni is not there, then again we are into a problem. So Vyayama, physical exercise has to be taken care depending on my physical strength, my age, season wise. In the winter we are advised to do exercises more. In a summer already the energy is not there up to the normalcy. So reduced exercises. So with the Vyayama also the digestive fire increases. Even the food which is not digested starts getting digested. So the appetite increases and Trishna, thirst also increases with Vyayama. Atapa, exposure to sun rays. Sun rays is very much necessary because it gives Agni, fire, enhances the light, color. Again with the exposing sun rays, blood circulation increases peripheral. Once the peripheral blood circulation increases, definitely you start moving, going with the exercises or Vyayama movements. And with that, Deepana, Pachana, Shuddha, Trishna all enhances. Maruta, exposing to the pure air. Exposing to the pure air, oxygen, prana, gets activated. With my prana, udhana vayu increases. My appetite increases. Vyana vayu starts moving easily. Energy happens with Vyayama as well as with Atapa and Maruta. Automatically, Dipana, Pachana, Kshuda, Trishna all happens. Exposing to pure air also helps into this. These are Shamana Chikitsa. So first we adopt all these things for a person whenever it comes. Then we go with the Panchakarma, or if the patient feels comfortable, we send them back home. Even in Panchakarma, without doing Dipana Pachana, we won't go for even Purva Karma. We don't allow the person to go with the Snehana Dravya to drink, whether it's the oil or the ghee medicated ones. So once the fire is increased only with Dipana Pachana, then Purva Karma, that is Snehana and Svedana, is done. After that, main Pradhana Karma is done, ends with rejuvenation. Here we will be covering mainly Bahir Parimarjana Chikitsa, transdermal administration of medicines. Basically, first starts with Taila Abhyanga. This Tila Taila is quite commonly used for anyone. Any person can use it. Even can't expect all the time to be getting done the massage. We can apply ourselves doing Nitya Abhyanga. Doing a Nitya Abhyanga, applying the oil whole body. If not possible for the head, it's okay, at least for the whole body. Health can be maintained. Skin pores are opened. The toxic elements are expelled out. Health can be maintained in a very good manner. Once circulation increases, oxygen supply is good for the person's whole body. Nutrition supplement happens because of a good circulation. Toxins also expels out because of dhuma outside of the vehicle or sitting in an AC. The skin pores are closed. The skin pores opens with regular abhyanga. Within seconds, it is a proven science, the oil can reach up to Asti Dhatu. Once Asti Dhatu is nourished with the oil, Asti becomes strong. Vitamin D deficiency, calcium deficiency, all can be taken care. Even if a person meets an accident or any wounds, it can heal faster because of a good circulation. Bone fractures also can heal faster. So in between Panchakarma Chikitsa, Abhyanga is regularly maintained. As a curative procedure in many diseases like simple body aches, hemiplegia, that is paralysis, do use Taila Abhyanga. Malnutrition, emaciation due to systemic diseases also, malnutrition persons also we do use. Ayurvedic pharmacy has a big store of medical oil selected as per the requirement, as per the condition and age wise also. Commonly we use Mahanarayana Taila for pains and aches, Ksheerabala Taila for neurological problems, and Mahamasha Taila for enhancing the bulk of muscles. We can use a combination of ghee, coconut oil and gingerly oil, where any aged person can use this combination of oil. Apply the oil, then take immediately the bath. As I told you, within 7 seconds, oil penetrates to the bone tissues. Next comes even in the same way, Tailabhyanga. This is Dhara. When two people are done, pouring the warm medical oil or even kashayas we use on the affected part for the specified period. This improves the penetration and effect of the oil. Oil similar to Abhyanga are utilized here also. With that, skin wrinkles are stopped, reduced, tan is reduced, circulation enhances, mind goes for mental relaxation, and person becomes healthier with a glow skin. Who are hearing to the class of our Ayurveda, anyone and everyone can use coconut oil, ghee and gingerly oil in equal quantity. Apply, take the bath and see the changes. These also are the procedures which we follow. Mastishkyam or Shiropichu. We dip a cotton material or a cotton in a medicated oil. Exactly keep on the center of the head part on the top. Or we can keep the cotton and then pour the medicated oil. Shiro Pichu or Mastishkya. In Mastishkya, we use medicament. The medicine is applied here, like example Brahmi or Amalaki powder. It's mixed with the buttermilk and applied for cooling the system or releasing the psychoneurotic problems. We use Shiropichu. Specifically, it is done on the daytime and then cleared up within. You're keeping it for half an hour. Shirodhara. On the forehead part, from the Dharapatra, medicated oil or kashaya is being poured on the forehead with a gentle manner, with the closing eyes. With that, the stress level, the tension in the head, everything can be cleared. Depending on the oils used, kapha dosha can be cleared, or vata or pitta can be cleared. Person becomes stressless, relaxed, in a happy, rejuvenating mode of aspect he can achieve with the Shirodhara. There is a particular measurements of how the Dharapatra should be done, how many duration the person should be used, and what of the times it can be applied and all that. That our people will be knowing, Ayurvedic people. Shiro Abhyanga. In Shiro Abhyanga, oil is applied to the whole head. When not only the head, even for front of the head, the neck part, ear, even the face, till the shoulder level, griva. Whole part has been used while applying the Abhyanga. With a gentle, particular pressure and technique-wise, massages techniques in a circular manner or lengthy manner or stretching or pulling, tapping, all has been used in Shiro Abhyanga, depending on the requirement of medicated oil, whatever the person needs. Shiro Abhyanga is also taken care. Shiro Basti, we do tie a, presently we do get a cap likes, or earlier they used to use a material with the animal skins, keep around as a cap around the head part. The medicated oil is being poured on a regular basis wise, depending on the requiring according to the condition of the person. Once the temperature of the oil is reduced, the oil is being removed and again warm oil is being poured. Seeing to that the oil leakage is not there anywhere. This also the procedure is known as a Shiro Basti. All these aspects will take care of our mental conditions, emotional conditions, stress levels to reduce, hypertension to be reduced, increasing the mental capacity, and hair growth aspects, all has been taken care here. If we keep our head cool, we say our whole body, the pada, becomes nice without painless. If you apply oil for the pada, your eyes gets cold and relaxed. If you apply oil to the eyes, it will take care of your nasal part. If you apply oil to the ear, whole head will be get released. This is also Bahir Parimaja Chikitsa, Guru Pravaranam. Here, one example I have shown you here. If a person is suffering from a fever, the whole body is covered with the woolen material and made him to sit wherever it is possible, or make him sit in a warm room where the sweating starts occurring. With that sweat, the toxins will be expelled out. After applying the oil, after Abhinga, Guru Pravarana is done. So the oils, medicated oils, whenever we do a massage, all the doshas would have come to the peripheral skin. From the peripheral skin to expel out by opening the skin pores, Guru Pravarana is used. Even in a fever, Guru Pravarana Chikitsa has been done. Even single part, if there is any pain in a particular part of a body, in the hand or in the leg, the same chikitsa can be done for local, sthanika chikitsa, what we call. Particular affected part can be cleared. This is Bhashva Sveda. After Snehana Karma, as a Purva Karma, Svedana Chikitsa can be done with this particular machines, yantras, where head is kept outside. The whole body is kept into these yantras. There, after Abhinga itself, the skin pores opens and toxins are expelled out. This is, third one is a Sthanika Bhasha Sveda. Particular area wise, if you want, only the neck area, you want the sweating to be done. Apply oil to the area, that griva, that's the neck part. Then with a particular machine projecting out with the steam can be done. Sthanika Bhashpa Sveda. Even Pottali Sveda also it is done. Can be done with the dry one. Dry medicaments are completely kept into this pottalis, the tying part with the cotton cloth, and apply oil and do the Svedana Chikitsa. Here also local Sveda, sweat is occurred. With the Sveda, the toxins are expelled out completely from the body, from the particular part. So the patient feels free, relieved from the blocked doshas. Sveda can be done in the Sthanika Sveda, Bhashpa Sveda, Pottali Sveda. There's one more Valuka Sveda, where in a bottle or in a cloth, we can say, not in a bottle, in a cloth, sand can be dried, heated properly on tawa. That sand can be kept into the wet cotton cloth so that cloth doesn't burn. That same way in a pottali, here medicament is used. Instead of medicines or the oil or the kashaya dipping one, if you use a sand, this will be known as a Valuka Sveda. In a dry Sveda it is, wherever there is a kapha blocked, you can use this. These are all actually Bahir Parimaja Sthanika. In a particular location wise, particular part wise, what can be done is Griva Basti, the neck. We do take black gram powder, mix it as a paste manner in a hard thick manner where we can roll it completely like a well format wise and fix it to the neck part. Here we pour a medicated oil inside this. Once the temperature of the oil is reduced, we remove the oil and pour the fresh oil. Depending on the patient conditions wise, in a cervical spondylitis or heaviness in the neck part, it can be used. Griva Basti. Jhanu Basti is done for the knees in osteoarthritis, pain in the knee joint. Kati Basti for the back also same aspect has been taken care. Sthanika Bastis, Griva Basti, Jhanu Basti, Kati Basti, even for the eyes it can be used. Akshitarpana, what we call. There we can use here Rukshaka Dravyas. Like if there is an accumulation of Kapha dosha and causing heaviness, swelling, all that, we can use a dry quality oil, dryness creating oil. Or if there is any katakatayana in the joints, if there is a katakata sounds are coming, crackling sounds, there we use a Brahmana oils. Yes, the joints have become dry, so we have to enhance the oiling conditions. If the person comes with the weakness of the joints, we use Brahmana oils, depending on the condition wise. Lepas. Lepas are beautifully done wise with the dry consent powders has been taken, mixed with the oil or with the water or with the milk or with the buttermilk. The particular area, if there is any shofa, that is swelling, this lepas are being applied. Based on the temperature, we do check in of the patient condition. Thickness of the lap also has to be taken care. In that we have a pralepa, is a cold one or a timid application which dries often. Some type it may not dry also. Like if there is a shofa, there is a swelling exactly like soft structured one. This type of a lepa has been applied completely to that whole area wise. Pradeha, the paste is either hot or cold, thick and does not dry at all. Thick coating has been applied. There, the medicament has to penetrate into the skin and support the skin part problems. If the dryness happens after applying a lepa, that means there is something inside that has to be extracted out, removed out with the force through the skin pores. So that type of a things will be known as in pralepas. In between above two is alepa, not too thick nor too thin. Pralepa is thin, pradeha is thicker one, lepa is in between two of thin. The medicines used as lepa for rice flour, wheat flour, ragi flour, paste of certain herbs like will be used. Lepa is beneficial in shotas, that is edemas, shofa inflammation swellings, abscess to, if the abscess is not ripened, to ripen the abscess also, we do use hot poultice. That is pradeha. So the abscess ripens and a small mouth like a projection comes where we can lick it out or it opens by itself. Abscess. Any itching is there, we do use some medicament. If there is a redness and rash or things, soothing like chandana can be applied. If there is only a pain management, we do use shunti, like examples like in combinations. Depending on the skin disorders, we do use lepa paste. Then comes bandhas. These are bandaging type. Thousands of years back itself, our masters knew the various types of bandaging based on the type and area of affliction. One of the important tools is wound management. If there we to stabilize and supportive ways retaining to the medicament, it is being used. Like copina, it has been used as a long back to stabilize the testicles, not for a man to go for hydrocele cases and all that aspects it has been used. Even waist bandha, kati bandha, there For a waist part, it has been applied in a thicker form after delivery in a ladies, so that the abdomen comes to the normal position, uterus goes back to normal position once the abdominal sagging is not being done. Even in the wounds, the bandages has been given whatever we are trying presently in a medicament wise modernized. It's all been mentioned in Ayurveda. Udvartanam. Type of massage, this is again performed with medicated herbal powders. The procedure involves rhythmic strokes with medicated slightly coarse powder we use. It helps in removing obstructions from the doshic and energy movements. Best remedial measures we can see in the excess adipose tissues to dissolve, like flabbiness and everything. That's the reason in an obese person, they do use Udvartana. Reverse way of massage is done because of the skin pores. It can be opened. Below the skin pores of each loma, there's a hair, the accumulation of kapha dosha will be there. That has to get dissolved. Means adipose tissue gets to start getting dissolved. Even in a skin diseases, cellulitis, it's not a skin cellulitis. There also we do use Udvartana karma, where we do use chandana, turmeric powder, kulatta, there's horse gram powder. When local, if the person wants to reduce the adipose tissue accumulated hanging below the hands or only abdominal part, or removing excess adipose tissue in the thigh part, local Udvartana, Sthanika Udvartana Chikitsa also can be done easily in a better form. Where some people do get irritation of the skin because of the dryness, at that aspect we can mix with the oil, medicated oils like Mahanarayana or Kshirabala or Pinda Taila. Only caution is to Pinda Taila is not heated. Combinations we can mix it and apply. Any Udvartana has to be taken care from downward to upward movement, down to upward, so the skin pores gets opened up, the toxins are expelled. Even excess sweating is there in the armpit, or a skin discoloration is there, thickness of the skin is there, Udvartana can be done in a better and easier manner to help a person to lose the excess weight accumulation or adipose accumulation completely. So with this we will be covering most of the major of an Ayurvedic subject, where medicament is being not explained here, because we should be in the condition to understand what is Vata dosha, how to locate it, identify it, Vata, Pitta or Kapha, or which doshas is dhatus have been affected. Depending on that, dravya, medicament is being taken care. Hence, the medical part, internal medication part is not covered at all. Instead of that, basic principles of Ayurveda, what is an Ayurveda, how Ayurveda has come to our world, that's our beautiful world, what is Panchamauta, Siddhantas, Loka Purusha Samyukta has been explained, similar Loka and Purusha similarities explained, what are Tridoshas, what is guna of qualities to be identified, what are the 6 stages, 10 pairs of gunas, 6 rasas, taste, whatever is there, which raja has which panchamahabhuta in it, so that which one to be used to in the medication meant as can be explained. In Vata dosha, what are the 5 divisions, prana dosha, Vayu, Udana Vayu, Vyana Vayu, Samana Vayu, Apana Vayu. Where are these sthanas? If they get vitiated, what exactly happens? Same way in the Pitta, Pachaka Pitta, Ranjaka Pitta, Sadhaka Pitta, Alochaka Pitta, Brajaka Pitta. All 5 types of Pitta has been explained, its qualities, its, if it is an excess, what are the causes? In Kapha dosha also, the 5 Avalambaka, Kledaka, Bodhaka, Tarpaka and Shleshaka, which part of body we can see has been explained completely. Specific identification, the duration of the doshas, which time which dosha will be in a higher positions has been explained. Saptadhatus, Rasarakta Mamsa Meda Asti Majja Shukra, what all it is made up of, what are the qualities of this dhatus in actions in our body. Mala, bio waste products also has been explained in detail and depth wise. Shrotasas wise also is explained wise. Totally 14 Shrotasas. Pranavaha Shrotas, Annavaha Shrotas, Udakavaha Shrotas, Rasavaha Shrotas, Raktavaha Shrotas, Mamsavaha Shrotas, Medavaha Shrotas, Astivah, Majjavaha, Shukravaha, Purishavaha, Mutravaha Shrotas, and Svedavaha Shrotas. Extra one has been included, Artavaha Shrotas, Shukravaha Shrotas. All this has been explained clearly. Prakriti wise, we can see Vata Prakriti, Pitta Prakriti, Kapha Prakriti in a person, Vata Pitta or Kapha Pitta or Vata Kapha Prakriti and Vata Pitta Kapha Prakriti. These are the doshic prakritis what we can see in the person. So what are the characters of how to identify in kapha conditions, their hairs, their body, weight, skin type. They all has been detailedly shown in the chart as well as with the figures. Then Agni, what is the quality of the Agni? What is the Agni? Manda Agni, Tikshna Agni, Vishama Agni, Samagni. What to be maintained, how to be maintained. To have a good health wise, Jataragni's part has been also told you people. Then there are few nyayas what we have spoken about. Kshira, Dadi Nyaya, the whole rasa converting to curds, ratta, like a milk converting to curds, this is there. Then Kedara Kulya Nyaya, Kale Kapoto Nyaya. So these are the three nyayas what we can see in Ekala Dhatu Pariposhana also is told to you people. Mala qualities also explained. What is swastha? Very, very important. What is disease? Roga Rogi Parikshas. What all will be checked in Pariksha Vidhi, Darshanam, Sparshanam, Prashnam. What all to be taken care, what all to be done. Trayostam, Swasthya, what is Swasthya? The detailed understanding we have done. Trayostamba, there is Nidra, Ahara, Brahmacharya. It is explained in the Ahara part, what, how much to eat. 50% to fill the stomach with the solid, 25% with the liquid, 25% to be given a space. Hina Matra, Ati Matra, and Kala, when to eat food, when not to eat. In Swastavruta, what to be regimen to be followed. Dinacharya, Rutucharya, and Sadruta. What from the time you are wake up to the sleep part, what all to be followed has been explained. Season wise, it is a Sadruta. What are the things to be followed to have a good life, a sound life. Then season wise also has been explained completely. What is the season, which season, what will be Agni capacity, what food to be taken. Conduct as well. Vegas, natural urges. Dharaniya Vegas, which has to be controlled. Adharaniya Vegas, which not to be controlled. 13 Adharaniyas, Dharaniyas are 7. That also is explained. Chikitsa, Chatushpada, Rogi, Dravya, Upasthatha, and Vaidya. There each qualities, 4 qualities has been explained. Then comes Chikitsa Sutra, where Antar Parivarjana, Bahir Parivarjana, Shadana, Shamana, Paya, Antarbhada, Panchakarma, Purvakarma, all the treatment has been explained. This is a brief, very, very brief knowledge about Ayurveda, but covered most of the basic knowledge of an Ayurveda. With this much of knowledge of an Ayurveda, you will be able to converse with an Ayurvedic people or any Ayurvedic doctor when talks about an Ayurveda part, you can understand. To go ahead with Varmam Chikitsa. Because Varmam of learning, you'll be working under someone. Please, my main request is don't think that only hearing to this or learning this much, you know whole Ayurveda. No. 5.5 years subject of an Ayurveda has been explained in a very small, brief note here. To understand such a beautiful science which is existing since 5,000 years. like Siddha. So have the knowledge of it. Go through it. Any doubts are there, please, you can talk to me. We can discuss about it little later part. Whenever our main people give a time, we can understand about it. Thank you very much.